There's no financial interest to declare. Hi, I am Lional Raj, presenting now a video-based course on Perspective of Femtosecond lasers in advanced corneal therapeutic procedures. A study of the indications of the first 100 femto procedures in our center has revealed 16% of indications lies in corneal therapeutic procedures. The high grade of precision of femtosecond laser lies in creation of a LASIK flap with ease and negligible surgically induced aberrations in the corneal refractive procedures of LASIK. Femtolasers optimizes the quality of corneal incisions and arcuate keratotomies in cataract procedures. The donor corneal tissue is mounted on an artificial chamber and is docked. A real-time OCT-based corneal lamellar graft is fashioned. A desired thickness of the graft and the diameter of the graft is fashioned as well by means of femtosecond laser dissection. The recipient cornea with granular dystrophy is then docked for a lamellar dissection of up to 90% thickness of the cornea and of required diameter. The femto-dissected donor lenticule is then separated with maximal ease and precision. And the same is performed on the recipient cornea too. The anterior corneal lamellae are then exchanged and fixed with corneal sutures of tenonylon for a greater precision and quality, and thereby improving the standard of vision when compared to a manual dissection. In cases of progressive keratoconus, a femto-assisted stromal bed of a desired thickness which ranges between 140 to 160 micron is created, and two incisions are created 180 degrees away from each other after marking the pupil and the limbus. The incisions are opened up and riboflavin is infused into the corneal stroma for an effective cross-linkage procedure. This enhances the depth of riboflavin absorption and a clear demarcation zone deeper than manual procedures, as evidenced by the OCT of cornea. A femtosecond laser help in the creation of tunnels and the incisions for intracorneal ring segments in flattening the steeper corneas in established keratoconic patients. The ease of opening of the tunnels and reproducibility is highly demonstrable. A newer advancement in the field of keratoconus management is the intracorneal lenticular transplantation procedure, in which the donor cornea is de-epithelialized, loaded in an artificial anterior chamber, and a femto-assisted lamellar dissection of a specified thickness of the corneal stromal lenticule, that is 140 micron in this particular case, is made. A bed is created with two incisions, one on the nasal side and the other on the temporal side, 180 degrees away from each other, at a depth of 160 microns, after exact marking of the pupil and the limbus. The incisions and the bed is opened up. A MST forceps is then passed through one incision through the cornea to the other incision. It grabs the corneal lenticule and it drags the corneal lenticule into the intracorneal layers to position the graft exactly in the center for a successful intracorneal lenticular transplantation, the post-operative day 1 result with a happy patient with a vision of 20/40. The corneal OCT and the slit image showing the lenticule in the intrastromal layers. It also helps in the management of refractory corneal ulcers by creation of a bed for intrastromal antibiotics. Herewith presenting a case of central corneal infiltration involving the pupillary zone and the visual axis and up to the mid-third of the depth of the cornea. A successful femtodissection posterior to the infiltration is performed. And a therapeutic deep anterior lamellar keratoplasty is then completed with an excellent outcome to the patient. The future of corneal therapeutics appear wide. Femto lasers redefines that.